The negative psychological impacts from COVID include moral injury, burnout, compassion fatigue, depression, anxiety, post-traumatic stress disorder or PTSD. The healthcare workers also shown depression and anxiety during the COVID-19 period. Again, PTSD was already mentioned. Actually, that's also observed among healthcare workers. PTSD in resuscitation providers is around 9.6%. And for the frontline staff in the pandemic is more than 10%, according to the studies. There is increased anxiety, depression, stress, negative feelings, which are leading to, sometimes self-harm in many cases. There is increased suicidal tendency among physicians observed in studies. There was other issues among healthcare workers include absenteeism, carelessness in protecting themselves, and expose others to unavoidable risk. Studies have observed that healthcare workers suffer from irritability, insomnia, fear, confusion, anger, frustration, and stigma associated with quarantine, which can be easily avoided. The prolonged isolation may increase the chance of mental disorders like mood swings, anxiety, addiction, and thought disorders. The other major causes of mental health issues is from the increased workload created by COVID-19 crisis and the fear of contagion among themselves. Frequently changed and added protocols, increased use of personal protective equipments, PPEs, care for very sick and quickly deteriorating patients and colleagues who fell ill all led to mental health issues. Constant fear of getting infection, unbearable stress, helplessness, and distress watching infected patients are leaving high pressure on the healthcare workers, and that is also reason for mental health issues. The media providing all these negative news, and they are constantly watching and reading these things, and also from the social media platforms, increases the chance of stress and mental health issues among healthcare workers. And another is moral dilemma leading to negative thoughts and concerns. We talked about increased use, but there is other cases, shortage of protective equipments. Then the long working hours, loneliness, physical fatigue, and separation from families, especially to protect them from getting COVID or giving exposure to COVID, all worsen the situation. Shortage of healthcare workers and the fear of infection with pandemic is also another reason. The increased psychiatric illness associated with COVID among healthcare workers can stem from uncertain prognosis, extreme shortage of resources for testing and treatment, conflicting messages from authorities, unfamiliar public health measures that breach personal freedom of healthcare workers, and the growing financial losses and financial burden, people losing job and other things, actually is leading to more psychological problems among healthcare workers. Physical exhaustion, increased workload, ethical dilemma on rationing of care. Sometimes they will have to choose between one patient or other based on the age or some other reasons that actually has a negative impact on the healthcare workers' mental well-being. Due to uncertainty of containing the virus, which still exists to some extent, healthcare workers can feel depressed, emotional, and angry. They seem to sleep less or sleep more sometimes, eat too much or too little, and they have also affected with low energy levels.